Hi, and welcome to Women's Health. Women's Health is a series of programs put on by the Women's Foundation of Lincoln and Lancaster County. I am Kathy Ermacher, the president of the foundation, and we're here today to talk about women and heart disease. The CDC recently said that 40 million women in our country suffer some form of heart disease. That's approximately 44%, and it is the leading cause of death in women. So we're joined today by Stacy Swen, who is here to talk to us from Bryan Heart about women and heart disease. Thank you for joining us.
Yes, thanks for having me.
So let's just start with some general symptoms of a heart attack. I know that when we talk about heart disease, a lot of time people just immediately think heart attack. And I know that sometimes the symptoms for women are different than they are for men. So let's talk about what a woman might experience if she is in fact having a heart attack.
Yes, so as we know, females don't always have traditional symptoms. Traditionally, we would say if you're having a heart attack, you may have like crushing chest pain, like an elephant sitting on your chest. It goes into your left arm and you're sweaty and, very noticeable. But over time, when we've done more research in women's health, specifically in cardiac health, we found that women don't always have those classic symptoms. They may have more subtle symptoms where they have maybe something they would describe as acid reflux. So maybe they have heartburn, they would think it's heartburn, but it could be related to having a heart attack. Or their pain may not be in the middle of their chest. It can just be in your arm. It can just be in your jaw. People sometimes forget that it could be jaw, but people think it has to be this, well, if I have jaw pain, but I also have to have the chest pain. But for females, we found that that's not always the case. I like to point out to people that when you're having a heart attack, a lot of times it was initiated by either activity or a high level of stress. And then sometimes if we call them like sputtering symptoms, so you're not having a full heart attack, but you're working towards it, you may have these symptoms show up with exercise and then go away without it. So when you're walking up a flight of stairs, you'll be like, oh man, it feels like kind of heartburn. Then you stop going up the stairs and it goes away. Those types of symptoms, things that are coming when you're exerting yourself, but then when you rest, they go away, and then you exert yourself, they come back. Those are the symptoms that we're more concerned about and that you would want to be evaluated to see if you maybe aren't having a heart attack right now or have the potential to have a heart attack. Like angina is the other word you would hear. But a lot of those symptoms are associated with exertion, but for females, they don't always have to even be in your chest. They don't have to be the classic elephant sitting on your chest symptoms.
Right. Okay. That's important to know. So what are some of the symptoms then of just general heart disease? If you're not just having a heart attack, but how can you know that you are at risk for heart disease or that maybe you have some sort of form of heart disease?
So there's different things that we treat as far as cardiology. So heart attacks is like a plumbing issue. So you have a blood flow issue where the plumbing to your heart is either blocked or narrowed. So that's what would cause a heart attack. You can have other cardiac heart disease such as heart failure where maybe the heart muscle is not functioning appropriately or it's at a reduced function. And those symptoms are different. Those could be like your worsening fatigue, shortness of breath. Sometimes it would cause you to retain extra fluid. So you'll notice you'll get swelling. Now some of it's hard because those things can be caused by a lot of other things not related to your heart, but it's always good to keep in your mind that those symptoms can be associated with those types of things too. We also do a lot with valves. As people get older, your valves may dysfunction where either it's allowing blood to go the wrong direction or they become stiff and then it's harder for the blood to get through the correct direction, but that can lead to some sort of heart dysfunction or heart failure like symptoms where you're getting shortness of breath, swelling. People should always watch their weight and typically are closely watching their weight, but your weight really, if it's related to gaining weight as far as fat, shouldn't go up super quick. So I always tell people if you're like, oh, all of a sudden I gained 10 pounds in a week. Well, unless you have a really good explanation for why you gained 10 pounds, you would want to make sure that it didn't have something to do with heart dysfunction where your heart pump function or your valves aren't doing what they're supposed to be doing. So that's, there's kind of plumbing, then there's kind of this overall like heart muscle function of the heart. And there's also rhythm issues. So, specialized cardiologists, electrophysiologists, they treat the electrical activity of the heart. And so that's when you're monitoring for atrial fib. So, and there's other rhythms, but that's the most common.
And that's called AFib by most people.
Most people call it AFib, and it comes from your top chambers, but they're not working appropriately. They're fibrillating. So it doesn't move blood as it would if it was pumping in a pattern. And that increases your risk of stroke. So when we're talking about reducing cardiovascular risk, we're talking about heart, but also stroke, and that they're a cardiovascular, that vascular part of your health, a lot of the same risk factors for everyone, and especially females, contribute. And when you have the rhythm issues, if you're already at an elevated risk of stroke and then you go into AFib or atrial fibrillation, you've elevated that risk. And that's where we're also trying to monitor for signs of that. And then if we can catch that early and get you on appropriate meds, then we hope we can prevent the likelihood that you would have a stroke. Those symptoms are similar. Shortness of breath, fatigue, sometimes you can feel lightheaded, but usually you'd also maybe notice a palpitation where you feel your heart racing. Or if you're checking your blood pressure on a regular basis, some of the cuffs these days will say irregular. Now, irregular doesn't 100% mean AFib, but it's a sign, something that you can check at home and notice that, oh, that's not normally like that. And then maybe you'd want to make sure that you don't have a rhythm issue, because AFib can also be asymptomatic. People can have AFib and we just find it accidentally when they're in the hospital and they are unaware of it, but that still needs to be treated. So, if you're checking your blood pressure and you feel fine, but your blood pressure cuff is saying irregular, or you find that your heart rate is higher than normal. So normally when you check your blood pressure, your top number of your blood pressure, bottom number, and then there's a heart rate on the cuff usually. If that heart rate number is normally 70 and now it's above 100, maybe you have AFib and you just never knew it. So a lot of people don't have symptoms of that, but that's one of the things that we're trying to weed out and catch between the primary care providers and us.
So there's a lot of things to consider, and not just when you have a heart attack.
Yes, there's a lot of
Right.
different facets of cardiovascular disease that, we're looking for and treating.
Right.
Heart attacks we talk about the most because it tends to be the most sudden, like you need to be seen immediately at times.
Right.
If you're having an acute heart attack, you need to go to the hospital
Dramatic.
and be treated in an emergency setting.
Right.
But there's a lot of these heart conditions that, come on more gradually, which is usually a good sign. If they come on gradually, usually we can treat them a little bit more gradually. But that would still cause you to have heart disease that could be, detrimental to your health long term.
Right. So when I go to my regular physician, to my GP, okay, and then I tell that person that I have some of these issues, I assume that some of those can be treated through regular exams or whatever. But when do we need to go to a specialist? When do we need to find some additional help?
There's simple things that your regular primary doctor would treat, but if they get to a point where, one, either the meds that they would normally use aren't working, or if you need an intervention as far as a procedure or a specialized cardiac test. Some of those specialized cardiac tests, such as a stress test, a transthoracic echo, can be ordered by your primary care provider, and they're usually read or interpreted by a cardiologist. And then if those results are abnormal, then a lot of times the primary doc would be like, okay, now go see the cardiologist so they can treat whatever we found, whether that be a risk of a heart attack or heart failure or atrial fib. Atrial fib sometimes is treated by your regular doctor, but sometimes there's procedures and other meds that cardiologists are more comfortable using and treating than your primary physician would.
Right.
And sometimes that's an access thing. If you live in Lincoln, all of those things are readily available, and you can, come and see us at Bryan Hart pretty easily. And we do go to a lot of communities across Nebraska. It's just less time or whatever. So I think sometimes in those communities that aren't directly in Lincoln or Omaha, the primary care providers are used to and more prone to treat some of those early cardiac issues more,
Right.
because they do it more often because they don't have the availability
Sure.
as much. So
Yeah, sure. We're hearing more and more about young people and heart disease. Are you seeing that? And do you have some sense of age that needs to be, at what age you need to really start thinking about it?
So if you're in fairly good health and young, the likelihood is not zero, but less. But as we start reaching 40 is where we kind of think you want to make sure you've kind of addressed and looked at risk factors, things that would put you on an elevated risk for having a heart attack, or coronary artery disease is what it would be. There are screening tests you can do for it too. So there's a score that's the American Heart Association comes out, and it's based on your age, your gender, your cholesterol, your blood pressure, if you're a smoker, if you're diabetic, and then it'll give you a risk. So it'll give you this percentage that says, your risk of a heart attack over a period of years is this. And we've found that, like, if we can catch people by doing that, so a lot of times that would be done by your normal doctor. And if that risk based on this calculator is elevated, then maybe you should, even if you weren't having symptoms, be screened. One of those options would be to do a coronary CTA, which is a score. So they go in and it's a CT scan of your heart, and they calculate a calcium score, and then that is put on a risk. So you'd get a report and it would say, based on your age and whatever calcium you had, you would be at low, intermediate, or high risk of having some sort of cardiovascular event in the next 10 years. Now, it doesn't guarantee it, but it's a way to be like, oh, should I be paying closer attention? Or, maybe it'll open your eyes to like, oh, I have let my blood pressure get a little out of control, or I have let my weight get a little bit higher than it would be ideal, and then like, you can start working on those things that reduce your risk before it's an issue. Ideally, preventative care is where we want to start. If you never have to see me, that's the best. If you can do all the things to keep yourself healthy and you never have to see a cardiologist, that's the ultimate goal. And that starts with those risk factors. So making sure that you're going to your provider on a regular basis, even if you would consider yourself young and healthy, making sure at least every year or two you're checking your blood pressure, making sure it's well controlled. That top number should be under 130. That's the newest recommendations, and it's gotten stricter over the last couple of years. Your cholesterol should be controlled. There's ranges of the cholesterol. Sometimes if your cholesterol is elevated, you can exercise and diet and adjust it. And sometimes even at young ages, you would qualify for medications to reduce your risk of having a heart attack. You need cholesterol medications. No one wants to take meds, but that's something you would hate to not know about, and then we could have prevented earlier. Weight, I think as we struggle in America with our diets are not always best, maintaining an ideal weight reduces risk for a lot of things, including heart attacks, stroke, getting diabetes, having high blood pressure. So, because the nature of cardiac disease tends to be people that are older, I see people, all the way from their 30s into their late 80s, 90s years old. It gets harder as we get older to lose weight or to increase your exercise because of other things, whether that be arthritis or, habit. You've had the same habit. So, preventing that up front and really trying to pay attention that you're like, controlling those risk factors as early as possible in your 30s, in your 40s, so that you don't have to see me that young. That hopefully you never have to see me, but if you're seeing me in your 60s, 70s, 80s, 90s, and not before then. Now, the people that were seen younger, either genetics, you can't avoid that. So some of it is genetic. So if you know that your family has a high risk, then you would maybe pay attention sooner too. So that's another reason I would recommend the screening. If your father, your mother, or one of your siblings had a heart attack or needed some sort of intervention such as a stent or a surgery in their 40s, then you should be looking before then. It's like screening for other diseases too, as far as cancers. You kind of want to start looking before whatever the onset of your family was. So if your father had a heart attack and he was, older, it's not as likely that genetically caused it. But when your dad had a heart attack in his 40s, you would be wanting to pay attention, making sure you've controlled your risk factors, and then maybe getting one of those screening scores done earlier, or seeing a cardiologist maybe earlier in your life than you normally would.
So you've talked a little bit about keeping your weight down, exercise, and what are we talking about with exercise? Are we talking about like you got to do the aerobics, or what are we talking about?
You want to do something that your heart rate is increasing at least a little bit. So walking is fine as long as, because that's your level of exercise, but that you're doing that walking at least long enough that your heart rate is coming up. You know, you're shooting for, you know, at least 150 minutes in a week period. And that's, you know, mild to moderate exercise, walking. If you doing more vigorous, you know, sometimes biking, you can get your heart rate up there faster, or swimming, which is a great workout, but you don't get it there as fast. You sometimes might have to swim longer.
How much do you have to raise your heart rate to get it to be beneficial?
That's a hard number. I'm not sure that there's an exact number, because a lot of things affect your heart rate, especially there would be like a too high heart rate. So you can calculate what would be like what we would consider your like max exertion, and it's around, you don't want to exceed like, I think it's like 220 minus your age. But in general, like normal heart rates would run between 60 and 100, and sometimes your resting heart rate when you're just sitting there would be normally to run somewhere between 60 and 100. So you're trying to increase your heart rate, you know, several points above whatever your baseline is, to know that you know, feel like you're exerting.
Right. So you don't want to overdo it, but you want to raise it enough that it's beneficial.
Yeah, it's very hard to overdo it. I feel like that's, you know, unless you're the very active, you know, and for most people, you know, we're talking like just get out there and make sure that you feel like you're exercising. The reason I bring it up is that some people will say, well, I walk all day. It's different if you're just walking 10 to 20 steps and then stopping versus going out and taking a 20-minute walk where you're like consistently walking 20 minutes, you know.
Right.
There's some difference in that. It's not a bad thing. You know, with all the trackers we have these days, people are constantly coming in and being like, oh, well, you know, 10,000 steps. That's great. That's a good sign. If one, you're paying attention to it, and two, that you're getting exercise. But it's best if we just like, you know, start a routine where we can like, you know, have consistent, intentional exercise.
And where you're pushing yourself above what you usually do.
Yeah.
So like if you get in 5,000 steps a day, but you're not really pushing yourself to use your
heart or your muscles.
Right, exactly. Your heart's used to 5,000. You need to push it to be a little bit, working a little bit harder. So that's one of the things for prevention. And then I'm sure that diet has a lot to do with that as well.
So the two diets that we tend to talk about the most as far as when you're controlling high blood pressure and cardiac disease would be a DASH diet or a Mediterranean diet. And you can look them up. In general, it's what we would perceive as healthy. You're trying to more fresh fruits, vegetables, lower sodium, low cholesterol, you know, leaning. I tell people try to like lean towards not processed food if you can. I'm not saying you eliminate it. I think that's very hard in how we currently are, and start small. You know, like in general, losing weight or adjusting your diet, if you do a crash diet or this drastic diet change, you tend to fail. So making small changes over time is usually best. So eliminate one thing at a time or control that portion one thing at a time. And those diets can help kind of, like keep your blood pressure down and reduce the likelihood that you would develop buildup in your coronary arteries that could lead to a heart attack.
And how much sleep we get, does that affect heart disease as well?
I think sleep in general is good heart health. Your body does a lot of reset when you're sleeping, and getting to good sleep when you get to REM sleep helps, your body just recover from a day-to-day basis. The other thing that is important when you're considering heart health in AFib is to make sure you don't have obstructive sleep apnea. So that is typically monitored by your primary care provider, but it's important for heart health that and if you do have obstructive sleep apnea, then you have to wear the machines or the CPAPs. And I saw there's a new commercial. There's new things coming out, so maybe you won't have to always wear the masks, but you can't just find out you have obstructive sleep apnea. You have to treat it.
And stick with it.
And stick with it.
Right.
Because it only helps you if you're treating it.
Right, exactly.
But it is important to monitor for that too, because obstructive sleep apnea can affect your quality of sleep and then does have long-lasting cardiac concerns, increases your risk of having high blood pressure, increases your risk of having atrial fibrillation, those types of things.
It's true. Well, thank you so much. We really appreciate your being here. This has been really helpful, so important for women and girls to know what it is that they need to do for their hearts. And so we really appreciate your being here with us. Thank you for joining us as well. I think you can find a lot of information about heart disease, and we will have some resources at the end of this taping. If you have any other questions, please feel free to contact us. This is the Women's Foundation of Lincoln and Lancaster County. Our website is lincolnwomen.org. And again, thank you for joining us.